All right, hi everyone. This is Rachel Lucas with WSLS News, and we are just under an hour away now from our special that we've been working very hard on for you, Opioid Nation, highlighting the epidemic of addiction to opioid prescriptions that's happening not only across the country but here in our area. Thanks for tuning in for this Facebook Live special. As you can see, I have three very special guests who are with Carillion, our partner in this endeavor. We really appreciate you all staying up late with us tonight, bringing this special. I first want to introduce you to Deirdre Ray. She is the director of Carillion Connect. They're the fine folks who are going to be running our phone bank tonight. So if you have any questions, concerns, they will be the trained professionals who will be answering those calls for you. We also have Dr. John Burton. He is chair of emergency medicine at Carillion Clinic. And then we also have Dr. Bob Tressman, Senior Vice President and Chair of Psychiatry at Carillion Clinic. So thank you again. Really tonight is all about kicking off our year-long commitment to combating this crisis, raising awareness. We want to help you take the first step to recovery and also really educate you about what is happening here in our community. It's all about breaking the stigma, giving you a platform to create that conversation with you and your family tonight, with your children, because that's really where it all starts. But I'll start with you, Dr. Burton. Really, who is impacted by this crisis? You know, it's not just something that we see on TV, it's happening to real everyday folks.
Right. I think that one of the things you want to think about is, as you said, breaking the stigma. And part of the stigma is that it can't happen to me or my family or my neighbors or my neighborhood. And the truth about the opioid crisis that we have is that addiction really affects everyone. It crosses all social, economic, educational boundaries, really even age boundaries. And it really is something that is one of the first steps to really understanding the crisis that we're in, is that everyone is really affected, and these old stigmas that we have of who it is and who the addict is and who has the drug problems, those just don't apply anymore. It really is everyone.
Sure, and you know, and especially age groups. It's not just one age group. It's our children, our parents, our brothers, our sisters.
Right. We see people who have addiction problems with opioids that start in their early teens, and we see it all the way into literally people who are in their 60s, 70s, 80 years of age, and everything in between. So it really spans the range.
Sure, and that's one of the things that we'll be talking about in the coming hour of our Opioid Nation, is highlighting these issues, really delving deep into it. And Dr. Tressman, what are some of the things that people should keep in mind while watching this special? What are some of the things that they should be thinking about?
Well, a few of the issues include, this isn't a moral failing. These are illnesses. And the more we can approach these concerns, these challenges that rip families apart and end up in the destruction of many lives, is that these are biological disruptions. We are learning more and more about it. We understand more about the underlying neurobiology, what's going wrong in the brain. But biologically, we can be extremely sensitive to the effects of different opiates. And it overwhelms, for many people, the ability to resist. So when we talk about stigma, that usually is associated with fear, with humiliation, with a sense of real loss. And the important thing for us to recognize is we can make a difference. And we're learning more and more about treatment and about recovery, both in terms of changing habits, helping to treat the illness biologically, as well as with new skills and new therapy. But it's so important that people need to be connected. They need to understand that in the same way you can't tell someone who's diabetic, keep your blood sugars under control, just don't eat, or only eat certain things. Well, that can work for a few people, but not for people who are severely ill. They require medical treatment with medication or with insulin. In the same way, those that are addicted to opiates usually can't just stop all on their own, not without help.
Sure. And, you know, I know it's important for doctors to be having those conversations with their patients, but it's also our responsibility as patients to be having these conversations with our doctors as well.
Absolutely.
You know, what advice do you all have for patients? not just your patient specifically, but all of us. You know, if we get prescribed these medications, you know, what is our responsibility?
Well, one of the issues for many, because keep in mind that many people who become addicted to opiates didn't start buying them on the street. They may have had an injury. They got started on opiate pain medication appropriately by a prescription, but then continued them beyond the actual need for pain management. Some of the laws in Virginia are now beginning to address that, and the challenge is for us as patients to work with doctors about carefully managing that. For some people, they may indeed require long-term treatment with opiate, and that's appropriate when it's a clinical decision made between the patient and the doctor. But for many times, we have to recognize that tolerating at least a little bit of pain is part of the human condition, and learning how to deal with it, how to cope, how to be hopeful is something we can all do.
I think that's very well explained, because we certainly don't want this to be used as a scare tactic, but we want to raise awareness about what can happen. But opioids prescribed by a doctor, as you said, with pain management, can be a very helpful thing.
Right. So I would think there's, in my mind, two types of patient scenarios that we might want to think about. One would be someone who's going into surgery or has an acute injury, and 10 years ago, 15 years ago, it was very routine to put those individuals on 30 and even 90 days of opiate therapy. And now we know that for the vast majority of people, that's not only not necessary, but it's not a good thing and leads to addiction in a number of people. Not in everyone. There's certain individuals who are more likely to get addiction than others. So back to your question then, is with those acute care people who are coming out of a surgical procedure or an acute injury, it really starts with a conversation with the prescriber, with their doctor. If they're being prescribed a certain number of days or weeks or even months of therapy, to then ask, is that the right amount of time for me for this illness? Why do I need to be on these medications for more than 3 days or 5 days? And really, what's my risk of addiction or of becoming dependent on this? Finally, then, the second group that I would think about would be those individuals with chronic problems, particularly if we think about chronic back pain and chronic foot pain, or a lot of different chronic illnesses, particularly that are not life-ending illnesses, that are going to be something someone's going to live with for years, perhaps decades, as opposed to something like cancer that we might put into a different category. And so those individuals who are on chronic pain and having chronic pain in their lives, they need to be speaking with their doctors about what are alternate therapies for me, for my chronic pain. Are there other approaches other than opiates so that I don't have the risk of having addiction in my life and in my treatment? And for those individuals who are already on opiates, who have been on those for years perhaps, or months for their injury, are there alternate ways to approach their pain, even though they've been using those chronically for long periods of time? Are there other ways to approach their pain and start removing the opiates from their treatment strategies?